The following program does not offer personal medical advice. Please consult your doctor before using any treatment or product we cover. Welcome to Go to Health Media with your host, Jonathan Marks. We provide a welcoming environment where experts educate you on important health topics, answer your questions, and provide information from which you can benefit in consultation with your doctor. You can visit and subscribe to the show at gotohealthmedia.com. And now, here is Jonathan Marks. Hey everyone, this is Jonathan Marks. Welcome back to another show of Go to Health. As we say at this time of the year, 'tis the season. 'Tis the season for flu, pneumonia, RSV, and COVID-19. Don't let these illnesses ruin your end-of-year holidays and celebrations. The good news is vaccines help reduce the risk of severe illness, particularly for older adults who are at greater risk for complications, and reduce the odds of hospitalizations from a respiratory infection. Immunization rates went down during the pandemic when many people missed routine care. For certain vaccines, progress is being made to get people back on track, but immunization uptake for other vaccines continues to lag. IQVIA tracks this information and has provided the latest trend analysis. COVID-19 immunization rates this fall were higher than they were last year at this time. Good job, people. But vaccination against influenza, a disease that sickens tens of millions of people in the U.S. each year, has declined every year since 2021. We also see stubborn disparities with lower immunization rates among Black and Hispanic individuals. With us to talk about this today is two experts, Nandini Selvam, PhD, MPH. She's the Vice President and General Manager of IQVIA Government Solutions. She has over 17 years experience in epidemiology, surveillance, domestic and global health policy, project management, and implementation at private, government, and academic settings. She's an experienced epidemiologist with a background working across disease and therapeutic areas: vaccines, infectious diseases, and chronic disease. She has served as the principal or co-investigator on a number of research studies at the FDA, the National Institutes of Health, and the National Institutes of Mental Health, and more. With us also is Michelle Fiscus, MD, FAAP. She's the Chief Medical Officer of the Association of Immunization Managers, or AIM. She leads AIM's CDC-funded project to improve COVID vaccination rates in children under 5 years and helps inform AIM's products, strategies, and policies. Dr. Fiscus is a board-certified pediatrician and former medical director of Tennessee's Vaccine Preventable Diseases and Immunization Program. She recently completed a 4-year term on the American Academy of Pediatrics Board of Directors and has served on work groups for the Advisory Committee on Immunization Practices. So welcome to the show, Nandini and Michelle. How are you today?
Good, thank you. How about yourself, Jonathan?
Wonderful.
Doing well.
Good. Great to have you both here. So the big question I have as we talk about vaccines for the holidays is vaccine hesitancy. There's been so much in the news that's incorrect information, improper information about vaccines and how they may be dangerous or hurtful. Can you speak more to the evidence basis of the effectiveness and safety of vaccines? This is so important.
I agree. It's so important. And, unfortunately, bad stories and scary stories go around the globe in just a minute or a second across the internet. And the good stories, the things about how people don't get sick because they were vaccinated, can take a whole lot longer if they ever get out to the public at all. So it's important to understand that people lie somewhere on a spectrum of vaccine acceptance. People who are ready and willing to get anything that's recommended to them, all the way to people who say that they would never, ever get a vaccine for any reason. And the important important thing to understand is that vaccines are tested and regulated and monitored more closely than really any other medication that we have. And especially the COVID-19 vaccines, they have been the most monitored for safety of any vaccine in the 200-year history of vaccines. And so I don't hesitate to tell my patients that they need to get vaccinated, that the parents need to get vaccinated. And it's something that, of course, I do for myself and for my family as well.
Good. Thank you for sharing that with us. And you made an important point, which I want people to understand. Not only are vaccines tested for safety as they're developed, but also the reactions to the vaccines are tracked as we go along. Is it the FDA or who tracks vaccine safety?
So the safety of vaccines as they're being developed is through FDA, and part of the whole testing and bringing something through the clinical phases to make sure that it's not only safe, but that it's effective in what it's doing, where we understand what kind of doses we need to give to someone to mount a proper immune response. And then once those vaccines are launched out into the public, then they're monitored through a whole bunch of redundant safety systems. Things like the Vaccine Adverse Event Reporting System, which is co-owned by CDC and FDA. That's where someone can go in and report on their own that they think maybe they've had an adverse reaction to a vaccine. And then those are investigated to see if there really seems to be a link between a vaccine and what was reported. And then there are other types of surveillance and monitoring that's done through electronic health records to see, did someone get a vaccine and then show up in a hospital with some kind of event that maybe was linked to a vaccine. So these are early warning systems that we have. You might see just a couple of cases of something, and then they can go on and look and make sure that there isn't some signal there that's telling us that this vaccine might be causing some kind of issue. We saw that back in the late 1990s with a vaccine called rotavirus, which is a vaccine that's given to babies to prevent a serious kind of diarrhea that could cause dehydration. And what they found through those safety monitoring is that there were about 14 cases of an issue with bowel obstruction with babies who had received that vaccine. And because of that early warning system, that vaccine was pulled from the market. And it took about 10 years before we got a new rotavirus vaccine after that. But it's a very sensitive system that really helps us understand if there might be something that we need to be concerned about and stop using a vaccine.
Good. Thank you so much for that information, Michelle. It's so important. So let me get now to vaccines and how they work and why people should take them. So let me ask the question. So how, if I do get vaccines, and I'm very much of a vaccine proponent, how long does it take for vaccines to work? I'm going to be seeing my family for the holidays. I'm just going to get my vaccine. How long do I have to wait for it to make sure I've got the protection I need?
So it really depends, but it's somewhere between 2 and 3 weeks for the vaccine to really kick into full effect and start pushing out the immune response that you need. And so looking that we're about 10, 15 days away from the big part of the holidays, right? So now's as good a time as any to go out and get your shots. This is for COVID. If you haven't already received it, definitely go out and get COVID-19, influenza, RSV, pneumococcal. So far, according to the CDC, just in this season, less than a third of Americans have gotten their influenza shots, and less than 20%, it's about 18%, have received their COVID-19 boosters. This is the right time. If you haven't done it already, now's the time to go out and get your shots.
Good. So that brings up the next question. Is it okay to get multiple vaccines at the same time?
Absolutely, and I think Dr. Fiscus says it well in the way she communicates this. But yes, absolutely, we can, and I have also received both my influenza as well as COVID-19 shots at the exact same time. But I think, Michelle, you say it very well with the children's example as a pediatrician, maybe.
Right. Well,
Yeah.
as a pediatrician, we always give multiple vaccines in a day to babies that come in. Even as young as 2 months old, we're giving vaccines all at the same time. So it's absolutely okay for adults to do that too. I also got my COVID and flu vaccines at the same time. The benefit to that is not only do you not have to go back and get other vaccines that you might forget about, but you also don't have to go back to a healthcare setting where there are people who are sick and have things that maybe you want to avoid getting.
Good point. Now, another question. Are vaccines covered by insurance? Do I have to pay out of pocket? Does insurance cover it?
It's a great question and one that I think people should know. Most vaccines, especially those recommended by the CDC's Advisory Committee on Immunization Practices, or ACIP, are covered. So whether you have private health insurance or you're in a public insurance like Medicaid or Medicare, they are covered with zero cost to you. For adults who don't have insurance or are underinsured, there are other mechanisms to get your vaccines. You could do it either through programs offered by the manufacturer. You can also get it through state and local health departments. And then for children, there's a fantastic program called Vaccines for Children. And this is a great way for children who are on Medicaid eligible or uninsured to get access to vaccines with little or no out-of-pocket costs.
Right. So there really is an incentive to get the American public vaccinated and safe from diseases, right? This
Absolutely.
reduces health issues. This reduces hospitalizations. Tell us about all the benefits of getting vaccinated.
Yeah, absolutely. I mean, according to our data, if you look and see between even the last season, so when we looked at data between October 2023 and June 2024, there were 35 million instances of influenza as an illness being documented through our claim system. And of those, 390,000 ended up hospitalized.
Wow.
And then we had 24,000 deaths that were associated with it. In the same time frame, amongst COVID patients, there were 44,000 deaths. So this is not, these are not conditions that have gone away by a long stretch. And then if you look at just the COVID numbers, amongst those that are vaccinated, the incidence of hospitalization comes down by 80% and death by 90%. So these are very, very effective.
Fabulous. Good. Those are great statistics. Again, I'm all about evidence-based. So let me ask a question. If I recently had COVID-19, how long do I need to wait to get vaccinated? How long does that immunity last?
So we think the immunity lasts about 3 months or about 90 days.
That's all.
You can get vaccinated sooner than that after you've had COVID-19, but you definitely don't want to wait longer than about 3 months. So if you had COVID during this last summer surge, July, August, it's time to go get this updated vaccine. If you haven't had a COVID vaccine since September, you're behind, and you need the most recent one to protect you from the strains of the virus that causes COVID-19 that are going to be circulating from here for a little while until they feel like they need to update the vaccine again.
Great. So talk about updating. Let's educate people a little bit about which vaccines are seasonal and which vaccines are once and done. Can you share that list with us so we are clear?
Sure. So when you think of COVID-19 and influenza, these are vaccines that are updated routinely. There are variations, there are mutations that happen regularly. So these are the ones that we consider seasonal, and the recommendation is for yearly vaccination.
Okay.
When you think of RSV pneumococcal, RSV is relatively new to the market. It's been around since last year. As of right now, the recommendation is one and done. So if you don't remember getting it last year, definitely go back and check on it. So RSV is recommended for all adults that are 75 plus. And if you're older than 60 years, then it's recommended if you have other conditions that make you high risk. And then pneumococcal actually has new recommendations in place. So if you're 50 and over, the recommendation is for you to get the pneumonia vaccine or the pneumococcal vaccine. And that too is a one-time shot.
Good. So what makes a distinction between a one-time and then a seasonal once a year? I don't understand that difference. Why the difference? What's the difference between the diseases?
The big difference is really the mutations that happen. So flu and COVID consistently have variations that they throw out, or variants that they throw out into the environment. And this is what requires updating. So we look at the last year's flu season or what's happening in COVID, and we make sure that there are new strains. So COVID-19, for example, we had a new vaccine introduced in September. So this takes into account what's circulating. With RSV and pneumococcal, not so much. They tend to be a little bit more stable in the way that they present. So a vaccine has a longer lifetime in the human body.
Got it. Great. So people can go to learn more in two places, and I'd like you to describe them for us. One is cveep.org, CVEEP, and that stands for Champions for Vaccine Education, Equity, and Progress. So that's one website you can go to, cveep.org, and the other one is vaccines.gov. When we visit those websites, what will we see there?
cveep.org is an excellent online resource for vaccine information and other resources as far as outcomes, etc., that are associated with vaccinations. And I also send people to cdc.gov because you get information not only about the vaccines, but also the underlying conditions of viruses associated with it. And then vaccines.gov is an online site where you're able to go to find locations around where vaccinations are administered.
Great. Thank you for that. So I just want to, as we end this interview, I just want to underline for people what we've just been hearing and learning is evidence-based information. It's not rumor, it's not stories, it's not inaccurate, it's based on evidence. And I want to thank very much our two guests. Thanks so much for being with us today, both of you. This has been Jonathan Marks. Thanks again for being here. And remember, as we say at the end of every show, go to health. Take care, everybody. Bye-bye. Thank you for tuning in this week to Go to Health Media. Be sure to join Jonathan Marks and another health expert next time. You can also catch the program on your favorite podcast platform. Until our next show, be sure to visit us on the web at gotohealthmedia.com and elevate your life.